Okay, so let's continue on this chapter, and the final part of this chapter would be to discuss about the health information cycle. So, and we'll see about this how transforming data into actionable knowledge can be helpful, and what is the information cycle really. So, as put forward by the WHO, so we'll see the steps of health information cycle. So, uh, the first thing is, why does we need the health information cycle? Uh, So one of the things is that healthcare systems generate vast amount of data. So you can see our healthcare system. Uh, so there are different routine and non-routine health information generated. So the routine health information system, like the health management information system, generated from hospitals, uh, health centers, health posters, using wide variety of tools. For example, the community health information system generates information on primary care, and the health management information system generates the different indicator based data from hospitals and health centers. Uh, so these are the routine information or data generated, and the non-routine ones like TB surveillance data, the different researches that are performed or surveys generate a wide amount of data from the health sector. So the health information cycle provides us a framework for managing this data effectively. So we have to be cautious of this data. So if we leave it as is, it's just going to be a waste of resource. So we have to think of a way to better use this information or data generated. So that means that's where the health information cycle comes into use or play. So it ensures data is transformed into meaningful information for improved patient care. So after using that specific data, we can improve the service, which in turn improves the patient care. The second one is effective public health initiatives. So we can identify different areas that are being affected by health disparities or health problems. So we can better intervene and have a better public health control over the country or over a specific region. So the third one is informed policy decision. So after all, as we have seen in the data information knowledge wisdom hierarchy, after all, it all comes to a single or probably two or three decisions. So that decisions is going to be decided based upon how we collect data, how we use that specific data, and we will have finally a specific knowledge or a specific wisdom that can inform policy decisions. So that would be how we can come up with uh, the health information cycle. So having said that, so we can pass to the first step. So the first step is data collection. This is the foundation of the health information cycle. So in data collection, sources of health data can be different sources. So it can be electronic health records, so different electronic systems that are implemented in different health facilities. So this can also be termed as electronic medical records. And the other one is patients report outcomes. So patients reporting different outcomes can be source of health information, and medical imaging, laboratory results, surveys, questionnaires, wearable devices, and health apps. So wearable devices are devices that are like uh, watches, for example, smart watches that collect data from data about our health, heart rate. There are different devices that collect data on even blood pressure and even distance we traveled, the amount of exercises we uh, work out, or different type of health data. So these are uh, also sources of health data and public health surveillance systems. So as discussed there are different surveillance systems specific to diseases, like for example HIV related surveillance or TB related, malaria related. So this also generates their data. So this we can use different surveillance systems to collect the health related data. So key considerations here are data accuracy. The first one is data accuracy and completeness. So whatever we are collecting, if it is not accurate, that means if it does not reflect what is on the ground, it's likely to be problematic. And completeness as well. So completeness of a data matters. So a data with high missing values be would not be beneficial to make decisions or inform policy. The other one is timelines of data collection. So timeliness, not timelines, timeliness of data collection. That means a data that is not collected at the right time or reported at the right time it is not beneficial, or it will be not as important as a timely data. So, for example, take uh, health facilities in our country. So they have a specific reporting period. So after in the last week of the month, the different health facility has to report to their specific bureaus, where the offices, and they have to also report to within a specific period of time to the regional bureaus and the regional to the federal. So this timeliness has to be maintained. So if not, that will create untimely information won't be used in decision making. So it's very expensive. So you invest so much in collecting data, but if you don't use it timely, that will pose a problem. So that's it. Data standardization is also another factor. So standardizing the data is important. So different electronic systems exist, but the way they collect data is quite different. So for that to to happen, so you need to have systems that are interoperable, so that use a standard procedure. So there are different standards in the electronic health information system. So if they are not using same standards, that will also pose a problem. And finally, privacy and security has to be considered. So whenever we use electronic or even paper-based or manual systems, the issue of privacy is important. Yeah, that's it. The second uh, part of the information cycle is data processing. So as it, you have to turn data into information. So this includes data cleaning. That means handling of missing values. If there are incomplete cases, we have to handle them using different techniques. And if there are errors and inconsistencies, we have to also make sure we handle those. So the beautiful thing is that we have different softwares, like for example, take DHIS. It takes care of missing values. It at least notifies you about missing values and errors. If there are any errors, the like more than expected number or less than expected number, the software itself alerts you. And if there are any inconsistencies, the software itself alerts you. So the use of different softwares will likely benefit the data cleaning process. The other one is data integration. So you have data coming from different software systems, you have data coming from different regional bureaus, where the offices. So you have to combine this data. So that is the step where data integrations comes into play. The third one is data transformation, that is converting data into a suitable format. So you might convert the data into like a suitable processable format, like the Excel file, the CSV or comma separated value file. And finally, you have validation stage, where you ensure data accuracy and consistency. So in this step, you can have the different standard coding systems like the ICD-10, SNOMED CT. These are standardized nomenclature systems or coding systems for the specific data set. The final one is the technology used. Uh, so you can use as such electronic health records or medical records, database management systems, data warehouse solutions. So this is like if you are using a huge electronic medical record system, you need to have a database. So that database is storing the data that is collected, and this is managed by a database management system. Okay, so furthermore, we have after converting it, we have the data analysis. So this is where you derive meaning, or more than a meaning, you derive insights from the data. So you generate a knowledge. So analytical techniques here, you can use summary statistics to summarize data. So number of ANC women attending first and fourth visits, for example, can be a summary data. So percentage of pregnant women attending all four visits, for example, you can mention that as a summary data. So inferential statistics, so you can make predictions. So for example, after taking into considerations the women ANC data, you can predict whether that woman is going to give birth through normal routes or is going to need a C-section. So this can also be predicted if you have enough data to predict that outcome. And data mining, you can discover different patterns. This also is similar to machine learning, where you predict, where you build a predictive models, and you can use statistical software like our Python SPSS to analyze this data or turn this data into knowledgeable or actionable information or knowledge. So examples of analysis can be like identifying disease outbreaks. So if there is a disease outbreak or not, evaluating treatment effectiveness, So that is if a certain treatment is effective on the population or the experiment or not. So predicting patient risk, analyzing healthcare costs can be done using the data. So the fourth part will be information dissemination. So this is sharing insights. Okay, so after you have found out or analyzed the data into a knowledgeable, actionable pattern, so you should communicate it. So this communication can happen in various forms. The first one would be to report by reporting it and publishing it to academic journals. The second one would be using dashboards and visualizations. You can use different dashboards like Tableau dashboard, Power BI dashboard, and so on, even DHS dashboard to show the findings using diagrams. The other one is presentations and conferences. So you can present these findings in conferences or even in meetings like the Federal Ministry of Health, for example, annual meetings, annual review meetings. The other one is online portals and databases. You can use databases to present your information and clinical decision support systems as well. So there are, after gaining an insight from data, you can turn that insight into a clinical decision support system. So a clinical decision support system is an electronic system that is used to decide on a clinical outcome or prescription. So take for example, a patient presents with different symptoms. So you will ask that symptom as a doctor. The doctor will ask that symptoms, and then the clinical decision support system will give that doctor, based on the symptoms, a potential diagnosis. So the potential diagnosis information might be this diagnosis information could be an aid for the doctor. So this is what clinical decision support systems are. So if we have a properly working system and we analyze data, we might have clinical decision support systems that assist decisions. The other one is target audience. In this case, might be different. So we might have healthcare providers. For example, clinical decision support systems work well for healthcare providers. Patients can be our target audience, so we can show patients the risk of, for example, smoking a cigarette by using different methods that we mentioned above here. The other one is policymakers. So after all, the aim of data and processing information is to inform policy decisions. So the other one is researchers. Researchers can also be audiences. So after conducting some sort of analysis, we can present it to researchers, and researchers can benefit from that by further including it to their further research. So public health officials, for example, take the EPHI, Ethiopian Public Health Institutes, and other regional public health institutes can benefit from our findings and strengthen their system. The fifth one is decision making. So after we have produced knowledge, we proceed to decision making. So there are types of decisions. One is informing clinical decisions. So we can turn how patients are diagnosed or treated after processing data. So for example, the different guides that are produced are guiding clinical treatment of patients or clinical handling of a certain disease. So this can change as a result of the data processing we've made. And then management decisions also. So as public health is concerned about the community's health, the community's well-being. So one of the aspects is the allocation of resources. So we can allocate a resource to a more resource-deprived area. So that is something that we will do at this stage. So the third one is policy decisions, as mentioned. So this consists of interventions, public health interventions, regulations. So this said, we can mention examples like implementing evidence-based guidelines, developing targeted interventions, allocating resources to high-need areas can be mentioned as an example here. The last one is the feedback and evaluation. So here, in the last stage, we will have the feedback. So after processing information and deciding, and after that informing policy decision, we'll have to monitor the impact of these interventions and collect data on outcomes, then evaluating the effectiveness of policies and identifying areas of improvement, and finally adjusting data collection and analysis methods. So the goal here is to create a cycle of continuous learning and improvement. So we can create a cycle that we can finally learn from if there are any mistakes that were made through the process and improvement areas that need to be improved to better achieve our goal. So that is the final step. So after reaching out at this step, the cycle continues and the data collection and other steps go ahead and continue. So finally, so the future of health information would be, it is like a crucial cycle. So the cycle improves healthcare quality and reduces costs in advancing public health. An emerging trend is example big data, AI are transforming each stage. So nowadays, like the creation of these AI systems has aided the different uh, cycles, the cycle itself. So we have to we have to find a way to integrate what is available in the AI market or in the AI ecosystem into this cycle. So the cycle will continue to evolve. So given the invention of the different new technologies, the cycle will continue to evolve. So finally, I would like to recommend the WHO guidance for health information system assessment. So how we can assess the different health information systems has been put forward by WHO, and you can go and read on it. So that concludes the chapter, uh, the introduction to information systems. So I hope this chapter was like it is a broad concept, but I hope that it has refreshed your memory into computers, systems, information systems, and introduced you to health information systems on a high level. So that means I will stop the recording. ኦኬ ሶ ኦኬ እንትኑን እያስተካከልኩ ነበር። ኦኬ አሁን መጀመር እንችላለን። So the next one would be a very short one, but an important one. So this might as well relate with your assignments. So introduction to information systems in the organization. This is what the course outline says. So we would try to change to specifically attach that to laboratory systems. So the first thing is we talked about what information systems are. So to revamp the memory, so we can say the definitions say that collect, process, store, and distribute information throughout the organization. So in the organization setting or in health facilities, we have different types of health information systems, and these systems work together. So their purpose is to support critical business functions like decision making, coordination, and organizational control. So different actors communicate with each other. Take a hospital, the medical laboratory technician and the doctor has to communicate, and other imaging or radiology professional has to communicate with the doctor, and even the receptionist or the triage has to communicate with the physician or the doctor. So one of the specific purpose of this is coordination of these different tasks and decision making as well. As mentioned, there are clinical decision support systems that aid clinical decisions, and as well resource allocation or administrative decisions may also be made by the information systems. And the other one is organizational controls. There are systems that manage the human resource and lets you manage or organize the health facilities or even a specific organization as a whole. Having said that, so components as mentioned, there might be hardware, software, data, people, and procedures that are already there that interrelate. These different components can be mentioned. So on a high level view, we can see the types of information systems starting from the bottom. Let's see transaction processing systems. These are processing systems at the root level, like day-to-day activities. If you take it in a hospital context, this type of systems help you perform like the encounter of a patient. So a patient's path from starting from entering the emergency or even OPD to when the patient is discharged or finished care. This type of systems that aid this process can be termed as transaction processing systems. Management information systems are higher compared to transaction processing systems in terms of a hierarchy. So these are specific on these systems. Specific information is reported compared to transaction processing systems. So it is like the summary of for example, patients that has been served by the OPD, for bed occupancy, for inpatients, and so on. So these are like summary informations. The other one is decision support systems. As we talked about earlier, so higher level managers or even clinical decisions can be made by information systems. So these are like more higher compared to management information systems. So after you have the rates summarized, finally you will make decisions, like for example to allocate resource, uh, like for example to if there is a shortage in bed, say, as a high level example. So this decision support system will alert you, for example, when there is a shortage in resource. Decision support system will alert the manager to, for example, using alert systems like red warnings. They can alert the manager to say that there is a lack, there is a shortage in certain level of decision, certain level of resource. So this type of systems are decision support system. Managers usually use them. Executive information systems are the highest one. So these are usually, if you take it in the context of our country, it would be the federal level systems where an aggregate information is reported, and this aggregate information from uh, regional offices will be used to make strategic level decisions. So this type of information systems can be termed as executive information systems. So this shows you the hierarchy of information system, but also at the same time shows you the hierarchy of organizations. So that would be uh, organizational information systems. And let's talk about specific laboratory information systems. So uh, as a definition, specialized softwares, information systems are the specialized softwares managing laboratory operations and clinical testing workflows. So this type of systems are used in the lab settings, and I think one or two applications have been given in this aspect of the in the individual assignment. So these are for clinical testing and different workflows in the laboratory. So key features, so for example, sample tracking, automated test ordering, standardized result reporting can be mentioned as a feature. So as a functionality, such laboratory information system might have this, but also many other functionalities. So as in every electronic system, the health laboratory information systems dramatically improve efficiency, accuracy, and overall quality of patient care as an end product. So that's it. The digitalization in health laboratories, like many in our country, like many areas, it's paper to digital transition is quite slow, but complete transformation from manual record to fully digital information management is quite essential in the regard of the benefits we mentioned. But still, in our country's context, there is a lack in transitioning. So, system integration. So, to transform these systems, so there should be a seamless connection with electronic health records and hospital information systems. So you will talk about what electronic health records are, what electronic medical records are in the chapters with Dr. Aya. But what I would like to say here is that so there are electronic medical record systems. These systems collect information about the patient and the care it encounters. Okay, so uh, this information is recorded, and then finally, after recording this information, so if there is any single information system in the medical laboratory setting or laboratory information system, this has to be integrated with the existing uh, medical record or electronic medical record. If not, the information will be first of all duplicate or redundant. So a patient has to give his information every time he goes to the laboratory, every time he goes to the even the medical record rooms. So it has to give out his information. So when it is electronic and when they are seamlessly integrated, that won't happen. No redundant information will be there. The laboratory information system can use the information from the patient's encounter in the medical record, and even the physician will have the documents related to the medical test is performed within the electronic medical record. So the other one is data analytics, advanced business intelligence tools to unlock patterns and insights from lab data. So the thing with laboratory information systems is you will get a summary, you will get an advanced analysis that you wouldn't in a paper-based system. So the digitalization of these health laboratory information systems is important. So some of the prominent challenges can be financial constraints. So these financial constraints come from so the maintenance costs associated with these systems and the budgetary pressure that these systems pose. So to maintain the system, to highly secure the system, you need to have finance. Even in the first place, in order to implement the system, you need to have a financial aspect. So that includes as well the infrastructure. So the infrastructure, in a sense, a stable internet connection, a stable power supply, is in demand for these types of health laboratory information systems. The other one is workforce adaptation. So, I mean, you can train staffs, so comprehensive staff training programs and change management strategies are essential. So, whenever a new system is deployed, there would be a resistance or there would be a disagreement between the old and the new system, right? So, those people who favor the old system or those people who are not easily adaptable to the new system would kind of refrain from using the new system. So you have to give them trainings, and even after trainings, that won't be easy. So this is one of the challenges in implementing a laboratory information system. So security concerns is the other one. So whenever you implement electronic or internet-based systems, so the risk of security and patient data breach is highly to be considered a huge challenge. The other one is technical integration. So as said, so if there is an existing infrastructure, if there is an existing electronic system within a hospital or within a health facility, you will have to integrate it. So the technicality of this integration also is a challenge when it comes to laboratory information systems. So these and others can be mentioned. So let's see the future trends in health laboratory information system. So the first one is the emergence of AI and machine learning. So this will mean that automated analysis and predictive diagnostics will be very highly likely to be done by AI and machine learning. So this is a very futuristic view of the laboratory information system. So the second one is cloud solutions. So in cloud solutions, you have we'll talk about what cloud systems are when we proceed to the next chapter. So cloud solutions are also available where you use the internet to host your application or your laboratory information system. The other one is mobile access. So that means you'll have the access to your lab or in terms of research, your lab results, your lab equipments. I think one of the individual assignments covers this aspect where remotely monitoring the laboratory stored equipments. So that's very interesting to hear about. So the other one is the security of the system. So nowadays, blockchain security or using blockchain as a method of securing these systems is so far a future, I would say, in terms of future trends. So having said that, we can see the impact of information system on health laboratories as a conclusion. So it has operational efficiency. So that means the operational efficiency. So compared to the manual system, so the operations in the lab will be more. The decisions in the lab will be more fast and become more efficient. This is a unique thing, I would say, for the the laboratory information systems. The other one is quality and safety. So enhanced controls will likely decrease errors and improve patient outcomes significantly. So the quality and safety would be a very good aspect of the electronizing or digitalizing health laboratories. And the other one is data-driven decisions and innovation opportunities. So these data-driven decisions, comprehensive analytics enable evidence-based operational improvements. So well, as I said, there are like clinical decision support systems that aid clinical decisions, and at the same time, there are medical test analyzing systems that aid the medical laboratory technicians. and the physicians to process or to decide on different medical tests automatically. So this will come with a huge benefit, and the innovation opportunity at last would be important. So having said that, uh, I think we can proceed. This is a very short chapter, so we can proceed to the next chapter where we have a practical demonstrations to do. So if your internet connection is stable, I think we should proceed and do the third chapter. Let me know if you are here still. Okay, so are you still with me? Can you hear me?